They are so small that you need a microscope to see them, but so powerful that they kill an average of 37,000 people in the United States every year. They are superbugs, drug-resistant bacteria that have emerged since antibiotics revolutionized medicine in the early 20th century. Indeed, the rise of these superbugs and the use of antibiotics are closely intertwined. All organisms change over time. This is a basic principle of evolution. Smaller organisms, such as bacteria, are able to evolve more quickly, adapting as circumstances require. In the face of antibiotics, bacteria have adapted with deadly efficiency. When a patient takes antibiotics to fight off a bacterial infection, the goal is to kill the bacteria causing the infection. Often, however, although most of the bacteria are killed, a few of the strongest bacteria survive. Thus, only these drug-resistant bacteria are able to reproduce. This sets up a cycle in which more and more powerful antibiotics are needed to counter bacterial infections, eventually resulting in the development of superbugs, bacteria able to resist even the most powerful drugs. There are some major factors that promote the spread of drug resistance. Of course, few would dispute that patients who are truly ill should take antibiotics, but one recent study suggested that almost 50% of all antibiotic use is inappropriate or unnecessary. Some patients take antibiotics for diseases that would eventually clear up on their own, or for viral infections, against which antibiotics have no effect. In addition, some patients do not finish their course of medication, allowing bacteria to bounce back, but stronger. All of these factors cause the rise and spread of superbugs. Although many doctors find it difficult to refuse when patients request medication, in this instance, what may be safe and effective for the individual can be harmful to society as a whole. Another major factor is the use of antibiotics for livestock. The Natural Resources Defense Council reports that 80% of antibiotic use in the United States is for animals. In part, the drugs are used to prevent the spread of infection among animals, especially those that live in crowded conditions. However, farmers also use antibiotics because these drugs help animals to gain weight quickly. Unfortunately, such non-therapeutic use of antibiotics is problematic because it kills off the beneficial bacteria that normally live in the animal's digestive tract, leaving drug-resistant strains of bacteria to thrive. The widespread use of antibiotics for the past 70 years in both the animal and human populations, and the resulting increase in drug-resistant bacteria, have fueled an ongoing search for more powerful drugs. In the early days of antibiotic research, scientists were successful in finding new classes of drugs, capable of fighting the drug-resistant bacteria that continually appeared. Since then, however, drug discovery has tapered off to almost nothing. Very few weapons remain against the deadliest bacteria. Late in 2015, researchers reported the emergence of a strain of bacteria able to resist even the most powerful medications, those only used as a last resort. What can be done to stop this cycle? Scientists maintain that as individuals, we can make a difference with simple steps, such as regular handwashing. It is also important that patients understand that antibiotics are not always the right course of treatment. They should not be taken for viral infections or even for mild bacterial infections. Finally, it is crucial to take antibiotics out of the food chain. Fortunately, consumers are pushing for this, so we are likely to see changes in this practice in the near future. The fast food giant McDonald's, which sells millions of pounds of chicken every year, has begun using only antibiotic-free chicken. If both individuals and corporations around the world continue to take steps like these, perhaps superbugs can be stopped.